I'm sure you remember the president said not long ago that this decision as to when he believes the nation should get back to work will be the most important decision and difficult decision of his presidency. Well, he did say he will offer those specific guidelines tomorrow, but today he did offer a spoiler alert. And that is, he said there will be a certain number of states that he will recommend should reopen within the next 2 weeks. And this is why.
We want to get our country open again.
But the question is where and when. There were mixed messages today from Coronavirus Task Force Coordinator Dr. Deborah Birx. On the one hand, she said there are certain parts of the country that have not identified many cases of the virus.
We do have 9 states that have less than 1,000 cases and less than 30 new cases per day. So we're looking at states and metro areas as individual.
But she also said this.
I will just remind the American people again, this is a highly contagious virus. Social gatherings coming together, is there always a chance that an asymptomatic person can spread the virus unknowingly? To all of you that are out there that would like to join together and just have that dinner party for 20, don't do it yet.
The nation's leading expert on infectious diseases, Dr. Anthony Fauci, told CBS News tonight reopening parts of the country will require adequate testing to identify those who are sick and enough resources to find and quarantine the people they may have infected.
The success or failure of that rolling reentry program, as I call it, would be the capability of being able to test, identify, isolate, get someone who's infected out of circulation, and do a degree of contact tracing. The absolute thing that you would need is to be able to respond and contain whatever rebound you get so that you don't wind up in a situation where you have another escalation.
And as some states like Texas continue border stops to order out-of-state travelers indoors, other states are saying it is clear they are not ready to get back to work.
The notion that we're going to go back to some sort of, let's just turn the clock back to 3 months ago, I just don't see it.
Maryland and Massachusetts announced they're hiring 1,000 workers to trace contacts of the infected. But today, New York Governor Andrew Cuomo said his state won't get there unless the federal government helps.
When you have a state that has to do a large number of these tests, I'm telling you, we can't do it without federal support.
Today, President Trump pushed back, saying it's the governor's responsibility to get the testing done.
We want them to do it. We're not going to be running a parking lot in Arkansas. We're not going to be running a parking lot where you have a Walmart.
The president is feeling pressure to get the economy back on track. Retail sales plunged a record 8.7% in March, and some Republican lawmakers are now saying saving the economy is more important than saving lives.
It is policymakers' decision to say this is the lesser of these two evils, and it is not zero evil, but it is the lesser of these evils.
But can the president guarantee there will be enough testing and contact tracing available in any area he wants to open up? The president says he will hold governors accountable.
And if we're not happy, we'll take very strong action against a state or a governor. If we're not happy with the job a governor's doing, we'll let them know about it. And as you know, we have very strong action we can take, including a close down.
So what is it like on the front lines of this crisis today? In New York, there were 2,200 new hospitalizations in the last 24 hours, and more makeshift morgues signal the death toll there continues to rise.
A lot of action going on today.
Mount Sinai Beth Israel ER Dr. Eric Eiding says he is still seeing a flood of patients.
Some people as young as in their 20s and people as old as in their 80s.
Being on the front line has taken a toll for healthcare workers. The CDC tallies more than 9,200 sick and at least 27 deaths, including Manoli Aya's mother, a Brooklyn physician's assistant.
She was my hero and she was other people's hero. And my dad likes to call her super mom because she really was.
COVID-19 hotspots continue to sprout up. The pork production plant in Sioux Falls is now the largest cluster in the country, with at least 644 cases linked to the facility. Nursing homes continue to struggle. In New Jersey, nearly every facility has at least one case. The death toll nationwide at more than 3,800. In some states, like West Virginia, the National Guard is conducting tests. Still, through the horror, there are bright spots, like in Oklahoma, where the family of Jeffrey Cowan was able to embrace after he spent 28 days in the ICU.
He was very, very critically ill, and he's very, very lucky to be alive.
And this somber moment at Arlington National Cemetery in the social distancing era, a soldier lowering his mask to console a grieving family as he placed the tri-folded flag on a table a safe distance away.
Today, the president said he will have a phone call tomorrow morning with all 50 governors. Then later in the day, he will share the guidelines he shared with them with the rest of us. Let's go back to you.